to talk about setup and maintenance of the level 1 infuser. So just some basics about the level 1 infuser. This machine is called the H1200. This machine, what it can do is it warms fluids, but it also rapidly gives them to patients. It does have an air detector down here as well, which I'll talk a little bit more about later. The type of tubing that we use is called the D60. This is a pediatric specific tubing. This tubing will allow for 750 mLs of fluid to go in a minute. And it is based on the size of your IV. Speaking of IVs, I'm going to turn this around. This is really important. The patient must be at least 20 kilograms, and they also must have at least a 20 gauge IV in place in order to be able to use this. The other thing is this must be plugged in to work as well. So that's one of the first things I'm going to do is get my plug and plug it back in again. So after you have it plugged in, I'm going to get things set up now. So I'm going to show you some of the doors that are over here. When you open up the doors, which are the pressure chambers for this pump, basically there's different hooks that you can use, and those are based on the size of the bag that you're actually attaching. So if you're doing a liter, a half a liter, or you're doing, say, a 250 bag, which has blood in it, you're going to be putting them on the different hooks based on the size of the bag. So to get things ready, first I'm going to open up my tubing. I'm just going to take all the packaging off. When you get your tubing is not going to have any of the clamps closed, so be aware of that. So when I get my tubing all opened up, one of the first things I want to look at is where my drip chamber is, because I do that with every tubing when I'm going to actually spike an IV bag. So I'm going to close down here, which is my roller clamp, so that I don't have anything going in. The other thing that I'm going to do is just clamp off. And this tubing, when you first open it, it is pretty hard. I'm going to clamp these two areas, which are going to spike to my bags. And then I'm going to spike my bags. So when I'm spiking my bags for the level 1 infuser, we are going to do something that's called burping the bag. So what we want to do is get the air out. So I'm going to take my spike, and I'm just going to put it in a little bit. I'm going to push all the air out, and then I'm going to spike it entirely. That's going to get all the air out of the bag. I am going to do the same thing with my second bag as well. You do need to ask the physician or find out how much fluid we are planning on giving the patient, because if we are giving the patient a liter, we can use a liter bag. If we're giving them 500, we would use a half a liter bag. But one of the big problems is we can't give them 430 mLs. We're just not going to be able to calculate things that way. So we have to get a good number of what fluids they want and tell them you can't choose. You have to pick a liter or a half a liter. So now I have both my bags spiked and I burped both of them. So now I'm going to set it up on the infuser. So the first one I'm going to set up on one of the lower clamps up there, and I'm going to do the same with the second one. And then I'm going to close both of the pressure areas like that. So now those are all in place. Next thing I'm going to do is kind of unwind the rest of my tubing. And I'm going to get it ready. So if you look at your tubing, it's actually, your machine, it's actually numbered. You have 1, 2, you have 3 down here, and you have 4. So I'm going to start with number 1. If you also look at your tubing, your machine, it's going to tell you some tips and tricks. Like one is, there's a little sticker here that says blue. So that's going to tell you that the blue end is going to be put into that area right over there. So that at least gets you kind of set up in a good position to move forward. So 1 is in place. I'm going to snap 2 in place over there. And then I also need to click this area in right here. And you actually hear it click in place. That's really important. This is an area that a lot of people have trouble with, and if it doesn't get closed, the machine is not going to work properly. So that's all set up there. The next thing that I'm going to do is I'm going to set up my area that has to do with filtering out air. So this is a filter, so you can give blood in the level 1 infuser, so you can use the same tubing as you would for fluids. If you look right here, there's a sticker that says orange, so that's going to tell me that the orange side goes up. 2 things to remember. When you are putting this in, it says blue right here, make sure that the left side, when you're looking at the actual machine, going towards the patient is the thick end of the tubing, because you need to have this end over this way when you're putting it into the machine. So I'm going to go for 3 and 4 now. So I'm going to click this into place down here, right, gently. So I have 3 in, 4 in. Now I need to set up my tubing. This is a door area here. Most of the time it's actually closed. I am going to open it, and now I'm going to feed my tubing into that area there, which is kind of the area that monitors the air. So once I have it nicely in there, I'm going to close the door completely. So now I have it all set up into the pump. So the next thing that I'm going to work on is starting to get the tubing primed. So I am going to actually unclamp one of these bags, and I'm going to start filling my drip chamber. We do this with IVs all the time, so it's the same kind of premise. You want to get your drip chamber filled about halfway. Once I'm done with that, I'm going to clamp this. I'm actually going to open the other side of my drip chamber and just put a little bit of the fluid in there from that side so that both sides are primed now. Next thing that I'm going to do is I'm actually going to open up my roller clamp there. So I know that everything is ready here. I'm going to look around just to make sure I have no other clamps that are locked. I know my machine is plugged in. I know that I have it in a garbage pail right now because I don't want it going onto the floor. So now I can actually prime my tubing. So I'm going to hit the green button and I'm going to turn my machine on. So something is obviously going on here. So the first thing I'm going to do is turn it off. And I'm going to just replace how this is put in here and try to lock it again. And then I'm just going to make sure all of my clamps are open. And I didn't open my clamp up here, so one of these has to be kept open. Not only does it have to be kept open, we're going to be pressurizing it as well. So I'm going to turn that back on again, and now I'm going to see what it does. Now I'm going to give it a minute to see about taking all the air out and see if that works. All right, so my little hurricane symbol right here is green now. So that means all the air is filtered out of there, so we can go and infuse it. I'm going to stop it again for a second because I don't want all the fluid to go through, and I'm actually going to clamp it off. So this is your air detector area here. So when you have a green light here, that's really good. We have to make sure that our clamps aren't clamped, because that's going to stop and it's going to cause it not to be able to flow. The other thing is we're going to look for a green light up here, the hurricane again. Why we're looking for that is that's going to be your temperature monitor, so it's telling you that it's getting the temperature up correctly. But again, it's going to be looking to make sure that you don't have any of your areas clamped, because it's not going to be able to flow. So I'm going to turn it on one more time and just kind of talk through this now. All right, so my infuser is going in. So I know that my bag is going to end soon. So what I am going to do is I'm going to clamp this, I'm going to open this, turn this off, put this one on, and guess what? Blood has arrived to the room. Since blood has arrived and I know this patient needs to get blood, I'm going to get my blood spike now. I know I already have tubing that's acceptable because it has a filter in it. On a blood bag, you do not have to prime the blood bag. You don't have to burp the blood bag because it already has the air all taken out of it. So now I know that this is going in. I'm going to clamp this side now, take this off, turn this one on, make sure that that's opened up, and now you're going to see my blood is going to be flowing in. As you can see it going through your tubing. And you can see how fast it's actually going in there. So this is why we have to maintain a one-to-one with this, because we have to watch, again, clamp. There's air going in. I have to open up my other one, turn this off, get my fluids flowing. So if I need to hang another unit of blood, I would hang the other unit in there as well. If you have to stop it to go to the floor, you can stop it, unplug it, and keep rolling. As long as it's pressurized, it's going to work. But the machine is not going to be on because it's not attached to electricity. But because you've pressurized the bag already, it's still going in. As you can see in the drip chamber, because this tubing is so big, it's just going to free flow in there. Again, when you're ready to disconnect, you're going to just clamp everything off, and then you're just going to connect a different line to the patient as well, unless they want to keep this line going, and they'll continue to give whatever they need to upstairs in this line. So that's everything about the level 1 infuser. Thank you.